So I'm going to kind of show you guys today why a dentist worries about a fracture in a crown or in a tooth. So fractures in a crown only progress as we chew, as we bite, clench, if we have any habits like grinding our teeth or clenching our teeth. So a lot of times people can have an issue in a healthy tooth of getting a root fracture or a fracture in the crown. If the fracture in the crown, if we can catch it before any issues occur, we help save the tooth. And we can do dental work, we typically do a crown. All right, so what happens if someone's never had a restoration, okay, gets a root fracture, what we see is an abscess. So right there's an abscess. This abscess is the indication something's wrong with the tooth. And then what is it? So what we go from is we go from looking at the crown, at that abscess, to pulling up and actually seeing what's going on with the tooth. So what's actually going on with the tooth is the tooth got chipped, it got a fracture in the top, and then it progresses, down the root. So we can catch it before it gets big, and we can catch it before it gets down on the root surface and do a crown. We stop it and prevent it. So that tooth that in the x-ray that had an abscess is actually this tooth. So the reason why we had to take the tooth out is now that the fracture is down the root surface, it gets a bone defect, not allowing the tooth to heal correctly or to save the tooth. So anytime we see a fracture in a tooth up top, we want to get to it as soon as possible and do a crown so that we avoid a root fracture or it breaking or fracturing into the root canal system and requiring a root canal. So if we can get to it sooner, it saves actually patient pain, money, and time.